Welcome. Today, we will learn about Mucolator medicine. Mucolator, acetylcysteine, are water-soluble. Granules, powder, in sachets. The compound is a white crystalline powder which has a very slight acetic odor. It is an N-acetyl derivative of the naturally occurring amino acid L-cysteine. Package contains. Each pack contains 30 sachets of 200 mg powder in each and in enclosed leaflet. Composition. Each sachet contains acetylcysteine ure, p. 200 mg. Dosage. See enclosed leaflet for complete dosage. To be dispensed only on the prescription of a registered medical practitioner. Indications. Usage. Mucolator is used as adjuvant therapy for patients with abnormal, viscid or inspissated mucus secretions in respiratory diseases. Acetylcysteine is also used as an antidote in the treatment of acetaminophen overdose. It is reported to be very effective when administered within 8 hours of acetaminophen overdose, with the protective effect diminishing after this time and being ineffective when administered later than 15 hours. Acetylcysteine is indicated as adjuvant therapy for patients with abnormal, viscid, or inspissated mucus secretions in such conditions as chronic bronchopulmonary disease, chronic emphysema, emphysema with bronchitis, chronic asthmatic bronchitis, tuberculosis, bronchiectasis, and primary amyloidosis of the lung, acute bronchopulmonary disease, pneumonia, bronchitis, tracheobronchitis, pulmonary complications of cystic fibrosis, post-traumatic chest conditions, atelectasis due to mucus obstruction, diagnostic bronchial studies, bronchograms, bronchospirometry, and bronchial wedge catheterization. Dosage and administration. Acetylcysteine may be given by mouth in doses of 200 mg 3 times daily in adults. Children, aged up to 2 years may be given 200 mg once daily, and those aged 2 to 6 years, 200 mg twice daily. In the treatment of acetaminophen overdose, an initial loading dose of 140 mg per kilogram as a 5% solution should be administered orally as soon as possible if less than 24 hours have elapsed since the reported time of ingestion. This is followed by oral maintenance doses of 70 mg per kilogram every 4 hours for 17 additional doses. If the patient vomits a loading or maintenance dose within 1 hour of administration, the dose should be repeated. Contraindications. It is contraindicated in those patients who are sensitive to it and those patients with gastroduodenal ulcers. Warnings and precautions. Acetylcysteine should be used with caution in pediatric patients, especially those patients 2 years of age or younger, as these patients may not be able to adequately expectorate. It should be used with caution in asthmatic patients, elderly or debilitated patients with severe respiratory insufficiency, pregnancy and lactation. There are no adequate and controlled studies using acetylcysteine in pregnant women. The drug should be used during pregnancy only when clearly needed. Since it is not known if acetylcysteine is distributed into human milk, the drug should be used with caution in nursing women. Adverse reactions. Adverse effects have included the following listed by MedDRA system organ class: immune system disorders, anaphylactoid reaction, nervous system disorders, headache, somnolence, ear and labyrinth disorders, tinnitus, respiratory, thoracic and mediastinal disorders, rhinorrhea, gastrointestinal disorders, stomatitis, diarrhea, abdominal pain, upper, nausea, vomiting, skin and subcutaneous tissue disorders, urticaria. General disorders and administration site conditions. Chest discomfort, chills, pyrexia. Sensitivity and sensitization to acetylcysteine have been reported very rarely. Storage. Do not store above 30 degrees Celsius. Protect from moisture. Do not expose to light. Following exposure to air, solution should stored at 2 degrees to 8 degrees Celsius and should be used within 96 hours. Manufacturer and buy online. Mucolator is manufactured by Abbott Laboratories, Pakistan Limited. It is available online or you can purchase it from any nearby pharmacy. It is available at the retail price around 660 rupees. Thanks for watching. Take your medicine as your doctor or pharmacist prescribes it.